Thank you, IGCS, for this opportunity. And this is a very important, we started with making committee on this, cancer survivorship. It is one of the most important area of cancer care which needs to be addressed. But unfortunately, it is most ignored area so far. And when you talk about the disparity in relation to cancer survivorship, there are, work going on in upper class country, but if you see in low and middle income country, there is hardly any efforts going, and this is very, very sad state of affairs. So I will try to, address all this issue in my presentation. I'm not happy with the organizing committee. This whole title is a book title, and they have an expectation to finish this book title in just 15 minutes, which is beyond my imagination. But I will try to cover up the main evidence why this is important. What are the important components which should be incorporated when you talk about cancer survivorship. I have nothing to disclose for this presentation. So who is cancer survivor? Every time you think that who is cancer survivor, there are many school of thoughts. You ask 10 people and everybody will have their own philosophy about who should be labeled as cancer survivor. Only someone who has been cured from cancer, also someone who lives in a long remission. You think that somebody has survived for longer, 10 years, 15 years, they are cancer survivor. Also someone with remaining with stable and the cancer without any treatment. They are not on treatment. Also someone under maintenance therapy. Many of the times you see patient was on maintenance treatment for many of the disease types. They are the cancer survivor, or anybody who has survived cancer for 2 years and they are on the follow-up. So this dilemma made me to search this keyword on Wikipedia, which is the most largest data sources, although not accurate, because you are always told not to believe what is written on Wikipedia. So cancer survivor is a person with cancer of any type who is still living. Whether a person becomes a survivor at the time of diagnosis or after completing treatment, whether people who are actively dying are considered survivor, or whether healthy friends and family members of cancer patient are also considered survivor. So whatever the knowledge I was having before reading this statement, I got more confused. So whatever the query I was trying to figure it out with the Wikipedia sources, probably I got more confused. So I tried to look for the better data sources. So I just looked into ESMO. So ESMO has a guidance on the survivorship. And what they say, survivorship is a pathway in fight against cancer, which is focused on health and the physical, psychosocial, economic issue of the life of people after the end of initial stage of the treatment. So that was more convincing than the other definition. So cancer, why we need to talk about cancer survivorship? Anybody who is sitting in the room has convinced that cancer has a rising trend. If you see the number of cancer survivor in United States of America, it is growing, and from the 77 to 2022, now we have a number of 1.8 million, 18 million people who are just, cancer survivor. If I talk about India, close to 2 million people are cancer survivors. So follow up. Now there is a question that, over the period of time, how things has changed. You see less than 1 year of, surviving people after the initial diagnosis. Now we have, too many numbers who are surviving more than 25 years age. With the advancement in the technology, access to the treatment, when there are more survivors, quality of life has become an important concern, and survivorship care is an important domain which provides, to ensure quality of life. As a doctor, like I'm an oncologist, my only duty is to ensure that patient is all right on radiological examination, on physical examination, on PET-CT, but we are just trying to figure out how we are adding, days to life. But when it comes to add life to each and every day, probably as an oncologist, we are failing, because after treatment, when patient has survived, we don't take any responsibility to figure it out what kind of problem they might encounter during the follow-up period. And I think in low and middle income country, where there is so many disparity in terms of access and outcomes, this is a very important and a wise decision to take when you have so many patients who needs the treatment guidance, whether it is the right idea to focus on survivorship, at the cost of the patient who needs treatment guidance. So survivorship, now we know that in many of the disease areas, survival is more than 90%. So with this aspects, we need to focus more on survivorship issues. This is basically data from USA, 16.3 million cancer survivors living 5 or more than 5 years. 69% of survivors have lived 5 years more than, from the diagnosis. 47% of the survivors live now more than 10 years, and 18% more than 20 years. So another data is, 67% of the survivors are 65 or older, and there are, if I talk about the gynae cancers, around we have 1.4 million survivors of gynae cancer. So this is the graphical representation of what I said in the previous slide, in the estimated number of cancer survivors in USA, site-wise, mostly breast cancer, prostate cancer, colorectal, then gynae cancer. These are the male and the female distribution of the cancer, which is prostate in male, and the female, it is a breast cancer. So different group of cancer survivor. Either patient have completed treatment, patient undergoing preventive anti-cancer treatment, like you see tamoxifen in the breast cancer patient who are hormone receptor positive, patient undergoing extended therapy in maintenance, you know about imatinib role in CML, patient undergoing prolonged treatment. So survivorship care is not about taking care of all these issues, what I mentioned. It talks about much more thing. Personalized follow-up plans, including secondary prevention features, coping with ongoing disease and treatment-related side effects, coping with compliance, trying to rehabilitate, getting body and mind back in shape, trying to reconsolidate social life both within the family and the community, trying to reintegrate, and dealing with uncertainty, which is a very problematic, and many of the times, most of the patient has this fear in this mind, whether this disease will come back again in their life, and that many of the people has a good balance, but many of the times you always, deal with such kind of questions, and, there is no scientific answer when they ask you, well, my disease will come back. If you say yes, they will be annoyed. If you say no, you are cheating with your patient. So these are the dilemma that you face in day-to-day life. So there are ranges of cancer experiences. This is that I have talked about. So prevalence, this is the Canadian things, and they said that 8 in 10 patients had physical challenges after their treatment ended, and fatigue was the most common difficult physical concern to get help for, and you need, after cancer treatment, fatigue is the most common. 7 in 10 patients reported having emotional challenges, so worry about cancer returning back was the most common concern for that lead to the emotional challenges. 4 in 10 patients reported having practical challenges after their treatment ended, and there are financial toxicity. Many of the times, we always have to take a balance between the treatment and after the generation that they just suffer from the financial toxicity, which is sometimes very, very difficult to recover. So general principles, surveillance of recurrence of primary cancer, screening of development of second primary. Many of the time patient has no idea that if they have suffered from one cancer, if they don't follow the screening guideline, they also can have the risk for the secondary cancer. Long-term physical effect of treatment, psychological and maintenance wellness. These are the survivorship experience of each person. Life is different from after cancer. Many of the time, you just see that patients say that my life changed after the cancer. And for us, after I joined oncology, I can tell you this is the only branch which tells you the biggest lesson of life. You see one patient, you have just told them that you have 6 months to survive. And you see their enthusiasm, their positivity, their ability to deal with the challenges. You really feel that we are very lucky that you have learned the important lesson of life. Most of the time we just do hue and cry for simple thing. And one person who is knowing that they are going to have another 6 months, learn positivity from them. So they always make you better human being. So I appreciate this is all, we learn during the practice. You learn to appreciate little things of your life. Appreciate life more. This is very useful. I have greater self-expectance. I feel anxious that cancer will come back. I feel more anxious about my health. So this is cancer rehabilitation is an important area in post-treatment patient. Patient support group is very much required for this to deal with the survivorship issues and psychological support. So gynae cancer survivorship, these are the point that I mentioned are the major problem when you talk about all the 4-5 cancers that undercover psychosocial concern. It's very common in all the cancers. Sexuality and intimacy problem is very common in the gynae cancers patient. Urinary dysfunction due to the treatment in which surgery is done, radiation is given in the post-op cases, bowel dysfunction, and post-treatment pain syndrome. There's another study, patient education and counseling. There was, they just proposed a model to guide clinical decision in treated patient, and they all discussed in detail. They almost covered 68 studies to make this framework. They discussed about physical need, healthcare challenges and preferences, sexuality-related outcomes, supporting the return to work, social support needs, psychological and emotional support, and altered self-image, how you deal with this. This is an important study. So this is, as for the good health is definition, physical, psychosocial, social well-being, and a spiritual well-being. And these are the different domains that disturb this domain, physical well-being, psychosocial well-being, and you have to deal with this with different approaches. So there is a very important slide. All of you has fairly good idea that WHO came with a proposal that we have to eliminate cervical cancer. Having said that, that incidence of cervical cancer has to come down 4 per 100,000. You see that if cervical cancer will come down, this is a 90, 70, 90 for the vaccination, screening and the treatment. And this is a very good approach. But, there is no such survivorship talk about cervical cancer. There are survivorship program for the cancer which affects the affluent people. But when it comes about the low socioeconomic strata people, there is not much discussion. Because in my practice, when you treat somebody from the low socioeconomic strata, like cervical cancer is a disease of low socioeconomic strata, after they survive from the cancer, they don't have time, they don't have money to, involve themselves in the cancer survivorship issue, because surviving from the disease itself is a big gain for them. They can't leave their one-day money for which, the whole family is dependent. But with this unique idea of WHO, more number of cervical cancer patients will come. So this is a unique opportunity for all the oncologists and the organization working on cervical cancer or gynae cancer to come forward and help their patient, because they're poor, they're from the low socioeconomic strata. They should not be left out to get the benefit when they get it from their peer group. They interact with each other. So this is an important domain, and there is many discussion is needed, because in coming days there will be many cervical cancer survivor in our community, in our hospital. So this is a consensus gynae cancer intergroup symptom benefit committee. They just recommended the minimum checklist. There are many organizations which talks about minimum checklist when the patient is survived from the disease, and when they come on the follow-up, you have to just evaluate your patient based on that checklist. Screening of breast, colorectal, and cervical cancer should be done. When they come on the follow-up, then you have always few of the cancer has the genetic predisposition, so you always have to look for the secondary cancer when they come for the follow-up. So this is the checklist that should be followed in different disease area. And gynae cancer, I don't know how many of you are practicing this, but if you're not doing this, start practicing this. So guidance, this is the healthy lifestyle and what to prevent. You have to prevent all this, what is mentioned here. So this is a guidance in survivorship. I know this is a very tiring task. This is a whole list that you have to look for, and probably the people who see 10 patients a day have to reduce 5 to a day to complete this checklist. But yes, there is a way out. You can find there are many organizations who has come forward with the checklist. You can find what is best suited for your clinical practice. So one is social support. There's another study which showed that if you have the social support, you have a better survivorship care, and caregivers has an important role to play at every level of cancer management. And if you have a good social support, you just get less time to come out from the disease-related psychosocial stress. So fear of recurrence is a very common. I have already talked about one thing which we don't talk about across the cancer type. Once patient is diagnosed with cancer, we always think, because I know this is the era driven by the companies, the way we counsel our patient, talk our patient about going for immunotherapy or targeted therapy, as your Surgeon General report has clearly mentioned, if you convince your patient to quit tobacco, once they are diagnosed with the cancer, it increases the overall survival, disease-free survival, but efforts are very less because that is the non-glamorous area, and we don't want to give our time because we have important immunotherapy to prescribe to our patient, and we might take 1 hour or half an hour to convince our patient to go for immunotherapy. And there has been seen many studies, they have shown that during the cancer, after the cancer diagnosis, you convince your patient to quit tobacco, the survival benefit is up to 10 months, which is we are expecting from most of the immunotherapy. So take-home messages: with more number of patients surviving cancer, quality of life is an important concern. Survivorship care is an important domain to ensure quality of life. Cancer survivorship is limited to few of the cancer that, like I said, cancer of upper socioeconomic strata. Cancer survivorship, not a much discussed agenda in low and middle income countries. There is a disparity and inequality in survivorship care in cancer. More efforts and action on gynae cancer survivorship is needed, especially in LMICs, and IGCS must put more efforts, like they have made a committee and we are doing so well. So more efforts in coming up with like checklist and more publication related to how to ensure a better survivorship care in all the cancer in GYN cancer. So we are looking forward for more support, more collaboration on this matter. These are the resources that I have found. If you want to know about cancer survivorship, you can just refer these resources. So the last line is I in illness is isolation. So people who are always crazy to say I, me, and I always find them ill and isolated. And crucial letter in wellness are we. So it is now the time has come when we have to work together across the geography so that we can solve a common problem, because healthy community have hope, and those with hope have everything. COVID-19 has taught us to make, every difficulty an opportunity, so we don't have to behave like a pessimist who think every opportunity as a difficulty. So looking forward to hear more from you. If you have any question, I will be very happy to answer. Thank you so much.